So my father is 89 and he has suffered from skin cancer for has had treatment for about 10 years. The last intervention was a few years ago, but most recently there'd been a return of it and he'd been referred back to the services via his GP. But on this occasion, he was referred to Basildon Hospital, where previously all his treatment intervention had been at Southend. So he wasn't quite sure why there'd been this change, and nobody had explained that to him. But he went to the appointment at Basildon, which was quickly followed up by a further appointment at Southend. So he wasn't really sure which hospital he should be going to for what, although he did have appointments at both. But it seemed that nobody had really explained this to him. In addition to this, he's had some other difficulties. He's had a triple heart bypass in the past and he is on warfarin. And one of the consequences of the surgery that he's had for the skin cancer is that it's interfered with his warfarin. So he's had to have a separate service in to give him injections to bring his warfarin levels and get them balanced out properly. And that's been very difficult because he has different sets of appointments for that. And two sets of appointments at different hospitals. So there's a lot of confusion about which appointments he should be going to, and there's been no real kind of comprehensive understanding or explanation rather of what all these are for. You know, he has become quite kind of muddled with what appointments he should be attending on which day, some of which are very, very close together. He had his surgery about 2 weeks ago, which took place at Southend Hospital. And on leaving, it was day surgery, so on leaving the hospital, when I collected him, he was given a large bag of medication, but there was no explanation as to what this was for. Some of it were for dressings, and he was told a district nurse would be coming in, but that then got confused with the district nursing service that was coming in to give him his injections for balancing out his warfarin. There was also medication there that we had no idea what it was for, so I then rang up the pharmacy at Southend Hospital to try and understand this, some of which was an antibiotic cream that was the same but in a different format from some other antibiotic cream he'd been given for something else. So he was very, very confused about what he should be taking. Generally, I mean, his mental state is pretty good, but he does suffer from some short-term memory loss. So all of this, you know, became very confusing for him. Since he's had his surgery, he's had further appointments at Basildon and recently attended a dressing clinic at Southend, which was a further appointment. And I did have the opportunity to speak to the doctor to try and understand a bit more clearly for myself why he was attending both Basildon and Southend. And whilst the doctor gave me the time and an explanation, I am still not entirely clear. But I think the whole point of this really is that there's been a real lack of communication between the various parts. And what would really have helped my father in his experience of this would have been just a kind of comprehensive overview to explain to him you know, in writing exactly where he needed to attend, what for, the list of his medication, what it was for, who was coming in, and the kind of timetable of that, which I don't really think would take that much work, but it just needed one person to have a kind of comprehensive overview of what was needed to avoid him getting confused. Because my concern would be that if he was on his own, he really wouldn't understand this, and I would you know, really question whether anyone of that age, whether they have any kind of memory loss or not, would be able to kind of comprehend that. I mean, I'm not quite that age yet, but I would still struggle to actually understand of all this that was happening at this particular time with him, with the numerous appointments he's had to go through. So it's really about, you know, the communication between the various departments, an explanation to the patient.